Question 2 is a frequently asked question related to cannabis and GI disorders is what is the evidence that supports use and what are the risks? And that will be question 3 that we'll talk about later. So cannabis use in GI disorders is based mainly on the physiology of where endocannabinoids and phytocannabinoids work at the endocannabinoid receptors. We know that there are immediate effects that in the modulation of the endocannabinoid system, that it can have impacts on the GI tract. Patients can have a decrease in motility and thus see a decrease in diarrhea. We know that patients can have a decrease in inflammation when in animal models these receptors are modulated. We know that there can be an increase in intestinal permeability. We also know that there can be reduced immune activation. So you can see that since there's direct impacts and there's endocannabinoid receptors within the GI tract, you can anticipate that this would have impact on patients' symptoms. And so you can see that it's been studied in various different GI disorders, and I'm not going to spend time in this quick overview going through the specifics, but there is data that shows that patients can feel better when using various forms of cannabis. Most of the studies that have been done, and still very small number as well as number of patients, have been done in inflammatory bowel disease. And so many of the patients that you'll talk with in your practice have an underlying diagnosis of IBD and are using cannabinoids to manage symptoms. There was a meta-analysis that was done that looked at the 15 non-randomized studies and the 5 randomized studies in IBD patients. And what they looked at as the primary outcome was clinical remission. And unfortunately, the use of cannabis in the randomized studies and in the non-randomized studies did not meet the endpoint of clinical remission. However, it did meet some secondary endpoints. Patients had reported improvement in symptoms. It's challenging to randomize a product that causes psychoactive symptoms with various THC dosing. So there is some difficulty with randomization in these studies and interpretation of these results. But patients felt better. They reported improved quality of life. But what we did not see in these studies was that patients had an improvement in their disease activity. C-reactive protein didn't change, fecal calprotectin didn't change, hemoglobin levels didn't change. So this could have potential for adjuvant therapy while we're working with FDA-approved therapies in certain patients that have persistent symptoms that are not responding to our conventional therapies. But what we don't want to get into is the risk that patients may stop their therapies because they're feeling better using cannabis.